Today we are going to discuss about the renal failure. What is renal failure? So it is a systematic disease and it is a final common pathway of many different kidney and urinary tract diseases. So this the meaning is what systematic diseases means renal system. Okay, it is the disease of a renal system and it is a final common pathway means so the patient who is showing the symptoms of the renal failure, that is not the initial stage. Okay, it is the result of the many different kind of kidney diseases and urinary tract diseases. For example, if you take like if the patient will first initially will have the complaints of like renal calculi or nephrotic syndrome, nephritis, glomerulonephritis. If the patient is not taking proper treatment on that stage, then the patient will land up with the renal failure. Renal failure is classified into acute renal failure, chronic renal failure. So in this video, we are going to deal with acute renal failure. Before starting the topic, just we will have a brief discussion about the anatomy and physiology of the renal system. So this is the picture of the renal system. The kidney are the pair of brownish red structures located retroperitoneal on the posterior wall of the abdomen from thoracic 12 to lumbar 3 vertebrae. It weighs about 120 to 150 grams. A typical kidney of an adult is 10 to 12 centimeter long, 5 to 7 centimeter wide and 3 centimeter thick, and it consists of renal pelvis and renal parenchyma, and nephron is the functional unit of the kidney and it consists of glomeruli, Bowman's capsule, proximal tubule, loop of Renal, distal tubule, collecting tubules. These are the parts of the nephron. And renal artery and renal vein supplies the blood to the kidney. And this is the brief introduction of the anatomy. Now we will see the physiology of renal system. It mainly regulates the blood ionic composition, maintains the blood pH, and it regulates the BP and maintaining the blood osmolarity, and it regulates the blood glucose level, and it produces hormones such as renin-angiotensin system, erythropoietin and 1,2,5-dihydroxy vitamin D3. And the main function of the nephron is glomerular filtration, tubular reabsorption and tubular secretion. Okay. Now we will see the definition of acute renal failure. Okay, so what it is? It is a reversible condition of abrupt deterioration in renal function. Means it is when the patient is in this condition, we can reverse the condition of the renal function over a period. Means if there is a abrupt means sudden malfunction of the renal from hours to days, which is result in the how we will come to know whether there is a patient underwent acute renal failure. Means there will be failure to maintain fluid and electrolyte balance, okay, and to excrete the nitrogenous waste products from the urine, okay. So that's the definition of the acute renal failure. And mostly it is associated with there will be increase in serum creatinine level and decrease in creatinine clearance, and there will be decrease in urine output which is less than 400 ml per day. Now we will see the etiology, the main causes for the acute renal failure. It is divided into pre-renal causes, renal causes and post-renal causes. Now we will see one by one. So what will come under pre-renal causes? The first cause in pre-renal is acute tubular necrosis. It is a condition which occur due to the lack of oxygen and blood flow to the kidneys. That leads to the damaging of the tube-shaped structures in the kidney, which is called the tubules, which helps in filter out the waste products and the fluid. So that is called the acute tubular necrosis, which is one of the cause to lead the acute renal condition, acute renal failure condition. And the next cause is renal perfusion. Renal perfusion means that there is a blood flow in the specific region, that is in the glomerular filtration. Okay, if there is any obstruction for this blood flow, that is also lead to the acute renal failure. And the next causes are circulatory volume perfusion or decreased cardiac output, vascular obstruction. In these three causes, that all main related to the circulatory disorders. If when the patient is having any circulatory or cardiac disorders, what will happen in this condition? There will be the decreased flow of blood to the renal system. That will land up to the acute renal failure. So these are the pre-renal causes, means actually there is no such problem in the renal system. Because of other conditions, there is an issue. Indirectly it is affecting the renal system. So that all causes will come under the pre-renal causes. The next we are going to see the renal causes. Renal causes means within the kidney system, renal system. Okay, if there is any issues related to the renal system, that leads to acute renal failure. So what are the causes? Like nephrotoxic substances like tetracycline, mercury, copper, which is very harmful to our body, and the renal system is failed to excrete that products. During excretion also, that substances will that destroy the nephrons. So that is also leads to the acute renal failure. Then acute infectious diseases. If there is an infection to the kidney, then metabolic conditions like such as hypokalemia, phosphatemia. Okay. Then glomerulonephritis. If there is any due to the conditions, there is a the deterioration of the function of glomerular filtration rate. So that will leads to glomerulonephritis, that leads to acute renal failure. Hemolytic uremic syndrome. If there is an accumulation of the hemolysis of the blood and uremia in the kidney, okay, that is also will leads to acute renal failure. If there is any thrombosis, vasculitis, infection or inflammation of the the blood supply vessels in the renal system. And tumors, okay, if there is any presence of cancer tumors in the kidneys, invasion, if we are doing any procedures, okay, that if there is a damage during the invasion procedures, that is also lead to acute renal failure. And cortical necrosis, due to the blood supply decrease of blood supply to the cortical region of the renal, that will also leads to the acute renal failure. So these are the renal causes. Now we are going to see the post-renal causes. Post-renal causes means there is an obstruction below the kidney, which is obstructing inability to secrete the waste products which are present in the kidney. So that leads to the acute renal failure. So here they have given the causes like obstruct in the urinary tract. If there is an obstruction in the urinary tract way, prostatic hypertrophy means if there is the cells which swelling of the prostatic gland, invading tumors, presence of tumors below the kidney, retroperitoneal fibrosis, if there is any fibrosis present in the retroperitoneal area of the kidney, and spinal cord injury, if there is an injury to the spinal cord. We have already learned in anatomy where means that spinal cord injury will also present at the thoracic and the lumbar vertebrae area. That is also will leads to the acute renal failure. Now we will see the risk factors. Risk factors means there is a high risk of the patient to go to the acute renal failure when the patient is suffering with this below conditions. They such as hypotension, hypovolemia and nephrotoxic agents. Hypertension, you know, in this condition what will happen means there is a decrease of the blood flow to the kidneys. So if the prolonged time, if the patient is suffering with the hypotension or hypertension, the patient can land up with the acute renal failure. Hypovolemia means decrease of fluids in the body. This can leads to the highest mortality rate in the patient. And nephrotoxic agents means if the patient is on the medicines, mostly like psychiatric medicines or depression medicines, that will contain the nephrotoxic agents. If you are taking prolonged time, that will also leads to the acute renal failure. So there is a risk for this in this condition. Now we are going to see the pathophysiology. Actually, pathophysiology of the ARF acute renal failure is not clear, but the theories will say that due to the etiological factors, that is pre, post and renal causes. That what they will do, it will disturbs the normal kidney function. So because of that leads to unable to filter the waste products from our blood in the body. Okay, so what will happen if the waste is not filtering, that all will accumulates in our body. Due to that, that will disturbs the glomerular filtration rate. So the function of the GFR will be decreased. So because of that, what will happen, whatever the accumulates in our body, that will causes cellular damage, which leads to the acute renal failure. Now we are going to see the clinical manifestations, that are signs and symptoms. So first is the oliguria. So there will be decreased urine output, okay, that is less than or equal to 400 ml per day, and burn increases, that is blood, urea, nitrogen, creatinine levels will be increased. That we already have seen in the pathophysiology, there is unable to excrete the waste products from our body, okay, due to the disturb of the kidney function. That leads to edema, anemia, hypertension, hematuria, blood in the urine, tubular necrosis, that is due to the cellular damage, and weight gain because of the decreased output, okay, fluid retention will be there, that will leads to the weight gain. Now see what all the diagnostic evaluations will done for the patient showing the symptoms. Okay, so first is urine analysis, that is simple one. Complete urine examination will do, urine specific gravity, serum creatinine and burn levels, culture and sensitivity test of urine will do. And if you are not finding anything about this, we'll go for the ultrasound scanning, CT scan and MRI. Now we will talk about the management. So how we are going to manage the patient with acute renal failure. So this we will be considering the three things, that is medical management, nursing management and dietary management. We will see one by one. The first one is the medical management. Under this we will see the pharmacology management. So drug of choice is diuretics, okay, diuretic therapy. In this the examples are thiazide diuretics, pharmacology name is hydrochlorothiazide, example acidrix. Another one is the loop diuretics, okay, pharmacology name is furosemide, example lasix. Potassium sparing diuretics, pharmacology name is spironolactone, example aldactone. Osmotic diuretics, example mannitol. So other than this, we will give the antacids, antihypertensive drugs, because there is a chance of increase in BP in the acute renal failure patients. So we will give antihypertensive drugs and erythropoietin, because there is a chance of decrease in RBC production. So for that we will give epoetin drugs in order to increase the RBC production. That's why the patient will show the symptom of anemia also. Then other this corticosteroids, example hydrocortisone. Other than this, we will give the treatment whatever the patient is showing the signs and symptoms, and underlying causes which will lead, which are the cause for the acute renal failure. Other measures in the medical management is dialysis. In dialysis, they will do the peritoneal or hemodialysis in order to prevent the further deterioration of the renal failure. Okay, patient in order to means it will take the time to cure or to get rid of the renal failure. That's why for the time being, for the temporary basis, they will use the dialysis also. And the next management in the medical management is continuous replacement therapy will be there. In that, first one is the prevent acute renal failure. So in order to prevent further damage to the renal system, we have to be done close monitoring of the central venous and arterial pressure, and monitor the early urine output of critical ill patients to detect the onset of renal failure as early as possible. And second one is maintain fluid and electrolyte balance. For that you have to maintain the IO chart, that is intake and output chart. Okay, then replace renal function. For this you have to provide adequate hydration to the patients, because there is a risk for dehydration, and to prevent and treat the shock promptly with blood and fluid replacement, and prevent infections. So to prevent and treat infections promptly, because they can produce progressive renal damage also. The next management is nursing management. In nursing management, there is a nursing process. Okay, there are 5 steps in nursing process in order to give the nursing management to the patient. So, what are that steps? Means the first is you have to done the assessment. Okay, the second one is nursing diagnosis, then goals or planning, then the fourth one is intervention, and the last, the final step is the evaluation. So, we will see the all the steps one by one. So now we will see the nursing management. Okay, now the nurse has an important role in caring of the patient with acute renal failure. So this management will mostly based on the assessment, whatever we will see. Okay, and assessment usually focus on the characteristics of the urine. So for that you have to assess the urine output. Okay, so for that you have to maintain IO chart. So you have, it varies from the scanty to normal volume. Then you have to assess the blood in the urine, because the patients who are suffering with the acute renal failure, there may be a chance of having hematuria, that is blood in the urine. Then assess the laboratory results. So you have to find out the laboratory findings, because they may be increase, decrease or stabilize the output. This one, what waste products which are accumulated in the body, that all we will find with the laboratory findings. Then you have to assess the nutritional status. So based upon the assessment, we can make a diagnosis in order to take care of the patient. 5 diagnosis. So that is also with the priority wise you have to do. So the first nursing diagnosis is electrolyte imbalance, that is related to, here RT means related to increased potassium levels, because the accumulation of the waste products in the body. Okay, so that's the first diagnosis. And the second is imbalanced nutritional status or imbalanced nutrition less than the body requirement, that is related to anorexia, nausea, secondary to disease condition, that is acute renal failure. And the third one is the excess fluid volume, related to decreased urine output or dietary excess and retention of sodium and water in the body. And the fourth one is deficient knowledge, related to the disease condition and its treatment. And fifth one is risk for infection, related to suppressed immune system secondary to acute renal failure. So these are the diagnoses we have made, depend upon the assessment. Now we have done the diagnosis. Now the goals. Goals or the planning for a patient with acute renal failure are: first is to maintain the electrolyte balance. Then second, improve nutritional status of the patient, maintain fluid balance, health education. We have to prepare health education to the patient. Then prevent infection. So nursing interventions, what all you will do in order to maintain the fluid and electrolyte balance? The nurse has to monitor the patient's fluid and electrolyte levels and physical indicators of the potential complication during all phases of the acute renal failure. Okay, you have to maintain the this one in order to reduce the metabolic rate. Also bed rest has to be encouraged. And the second one is, to maintain the nutritional status, you have to encourage the patient to have small and frequent meals, and the diet which is taken, it has to be high in carbohydrates, rich in proteins. Okay, and the sodium restriction and potassium restriction diet has to be given. Okay, so third is what, in order to maintain or fluid balance, maintain the input and output chart. Skin care has to be taken. You have to encourage the patient to have a bed rest. Okay, frequent changing of the position. Okay, in order to improve the skin integrity. Okay, and if the fourth one is health education, that you can prepare the health education on the topics of the disease condition. You can educate the patient about his disease condition, its treatment, prognosis, and you can educate the patient on the dietary management, what all the diet he has to take on. You can educate the patient what all the changes he can do in order in day-to-day life, in order to maintain or the risk or to decrease the risk of disease condition. Okay, then the fifth one is to prevent infection. You have to always follow the aseptic techniques. Proper hand washing has to be done. If there are any invasive procedures are there, like for example catheterization, see that it has to be minimal. Okay, it is minimal, or avoid as possible in order to prevent the infection, okay, introducing of infection. So see that if it is necessary, then only you can do the invasive procedures, otherwise it is no need, okay. That all you have to take care. I think the video is going to be lengthy, but I doesn't want to compromise with the video quality. Okay, so I will explain. I'm going to explain everything in detail. Okay, coming to the topic, the last nursing process step is evaluation. You have to evaluate the nursing care, whether it has to be reached properly or not to the patient. So how you are going to evaluate? First is you have to maintain the electrolyte balance. How you are going to confirm that the patient having the maintained electrolyte balance means you have to check the laboratory test, okay, that electrolytes everything will come, normal findings you will find out. Then improved nutritional status, intake of the patient, that he will gain the healthy diet, healthy weight, okay, he will have a balanced diet, so he won't have any issues about that. Then restored fluid balance, so there will be maintaining the IO chart properly, there is not much difference is there, there is absence of edema, improve the skin texture, okay. So that with that all everything we will confirm that the restored fluid balance and gain the patient confidence that now the patient is not having any complaints or any queries about his disease condition, he is able to take care of himself, okay. So with that we can understand that the patient gain the confidence about himself. Then prevented infection means the patient is having absence of fever, okay, there is no further damage of the damage or deterioration of the condition. So with that we can understand that there is a prevented infection. So dietary management. So in the dietary management, replacement of dietary proteins is individualized to provide the maximum benefit and minimize the uremic symptoms. Okay, likewise caloric requirements are met with the high carbohydrate meals because carbohydrates have a protein sparing effect, and foods and fluids containing potassium or phosphorates are restricted sodium diet, everything. So for example, like bananas, they have to not, they should not have a bananas, in that potassium will be more. Likewise, then the patient should be placed on a high protein and high caloric diet. Discharge and home care guidelines. So in the discharge, the nurse plays an important role in teaching the patient and family with acute renal failure is that you have to tell about the nutrition, okay. A referral to the nutritionist is made because of the dietary changes are required, okay. And problems to report, the patient and family must know the what problems to report to the healthcare provider. So you have to tell about, so what all, now I'm not going to in the brief discussion, okay, everything I have explained in detail. So you have to know what all you have to tell. And follow up examination, the importance of examination and treatment is stressed to the patient and family because of change in physical status and renal function. So documentation guidelines means you have to focus the documentation in a patient with acute renal failure, which includes vital signs, muscle strength and reflexes, result of laboratory findings, okay, deficient and current source of fluid intake, IO chart, plan of care, teaching plan, and client's response to the treatment, teaching and actions performed, and desired attainment or progress towards the desired outcomes, modification to plan of care and long-term needs. With this, I have given the detailed presentation on the acute renal failure. In the next class, we will going to learn about the chronic renal failure. Okay. If you like the video, please like, share and subscribe. And we will meet in the next video. Until then, take care. Bye.